So good morning, welcome, and thanks to everyone, to the people present and to the people connected online. And a warm welcome to Professor Gams, our today speaker.
Hello.
My name is Antonella Varesano. I represent the Alto Adriatico Technological Park, which is located in Pordenone, Friuli Venezia Giulia region. Founded in 2002, the Alto Adriatico Technological Park deals with technology transfer and entrepreneurial development. I am in the space in the urban center of Trieste, which is an important redevelopment that the municipality of Trieste has developed in the center of the city. The space was conceived as a ground for the development of innovative entrepreneurship in the high-tech, biotech, or in particular in biotechnology, biomedical and bioinformatics, and in all the health sectors. Today's event is one of the busy calendar events that populate the urban center every month, and is with pleasure that I introduce Professor Gams, Head of Department of Intelligent System at the Josef Stefan Institute in Ljubljana, which is one of the partners of the Urban Center. I also want to thank Professor Primoz Kochuman, which helped us in this important meeting. Professor Gams is also National Counselor for Science, i.e. member of the National Parliament. He teaches AI, cognitive science, AI in medicine and business, and he's co-author of over 150 papers in scientific journals, has several patents and several applications. With his talk, Professor Gams will take us into the topic of Slovenian health system toward electronic and mobile health. The title of his today presentation is Electronic and Mobile Health in Slovenia. Can it help transform Slovenia health system? I would like to remind to everyone that at the end of the lesson, it will be possible to ask questions, and also that all talks are recorded and will be present on the Urban Center website. I thank you all for your patience, and I give the floor to Professor Gams. Thanks.
Start sharing screen. Do you see me okay? Do you see the screen okay?
Yes.
Okay, great. Thank you very much, dear Antonella, for inviting me here. It's really a special honor and pleasure. And buongiorno a tutti. Yes, maybe we start with the presentation and see what's going on. First, welcome. Well, thank again for the organizers. And it's really been a pleasure. I really wanted to come in person, but the last week I was in Spain, and there is a new version of this COVID, which seems to avoid this defensive mechanisms in a human body, even after 3 vaccinations, as I did. So it seems that we're not going to get rid of COVID soon. Second, I also remember coming to Trieste for the first time. It was a long time ago. At that time, we were students. We were buying jeans, and you could go to Trieste and buy jeans, but you couldn't import it back to Slovenia. So we typically either threw away our existing old trousers and came back in jeans because that was okay, or we bought jeans and put it under the existing trousers. So it's really funny to remember stuff and to see how far we have progressed from that times. Yes, the lecture is going to be a little bit demanding, so it's not going to be just a simple lecture. At points it will be let's say, at high level, it will demand your patience and understanding. And I apologize if it will be too direct at times. I'm an engineer trying to be as polite as possible, but you know, the engineers, and we are not always very technically correct. And yeah, so let's start. I come from the Stefan Institute. This is the main building on the left. I hope you can see my cursor. Joseph Stefan was a well-known physicist. He invented some laws like the Stefan-Boltzmann law, how the heat emits through bodies, through air to the bodies. This is another location of the Joseph Stefan Institute. Altogether, we have about 1,100 staff. And if you look per capita, it's about the same as in Germany, some institute, or France. And actually, we have about income about roughly half of that from Germany and France. We publish and we do kind of top research in Slovenia. For example, we publish 34% of articles in top 10% of scientific journals and 18% in top 5%. So there are some indications of the quality of the Joseph Stefan Institute, which are more or less internationally accepted. And if you look at our department, probably it's easy to check that what we do is of relevance at the what level. For example, we, in the last, say, 10 years, we attended 10 open competitions, and we won five of them, and we were never worse than fourth. And for example, this Huawei, so that's the Chinese company, and Sussex, that's the university from UK. At that competition, we won the first and the second place. So we're quite happy about that. You don't always get first place. And in this competition for COVID, we actually won the second place. It was the X Prize competition, and the award for the second place was $250,000, which was total surprise to us because normally you get just some thanks or some minor amounts of money, but this one was quite successful in international terms. Now I will spend some time on COVID because COVID is still relevant. And you see, these are the results of the competition. Number 1 and number 2, so red and blue are very close. We were the second, very close to the first one. But then if you look at the third and the fourth, you see that already the fourth is much worse than we were. So there were actually just really two good competitors. And maybe the third one was kind of okay still. The results are presented in Pareto front. Our experience is that people with medical education do not get any information about Pareto front and multi-objective criteria optimization. So I will try to explain you the Pareto front. Instead of trying to optimize in one direction only, for example, how to cure a person, but without taking care of all the other consequences, here you typically take a look at 2 attributes, or 3 or 5, but let's take a look at 2 of them. Here is stringency. This is the cost of the countermeasures against COVID, interventions against COVID. So the competition was at the beginning of 2021, and at that time, countries applied several measures like masks, like closing schools, closing businesses, etc. So there are, let's say, 10, 20 measures of that kind. And of course, you can use them not only some of them at some specific time, but there is also some schedule. What happens the next week? What happens the next month? So this competition was lasting for 3-4 months, quite a long time. And the results are as mentioned. So here, of course, if you close the economy, it costs something. If you close schools, it costs you something, and the cost is not just economic, the cost is also social. So the cost is altogether presented here as stringency on the x-axis here in this picture, and on the y-axis we have the number of new cases. So how many people will get infected by COVID. You can't reach left down because left down is 0, 0, and you can't reach that because it's impossible. You have an infection, so people are infected. But you try to get as low left as possible, and the closer you get, the better. But here another phenomenon occurs. If you look at the red dots, for example, this one and that one, you see that they are different, and you cannot directly compare them. One of them has fewer infections, and the other one has different stringency. So you can't say which one of the two is better. And that's why this red row represents the so-called Pareto front. So these are the best solutions. They are equally good, and you choose according to your subjective criteria which one is most suitable for you. But if you look at some others, for example, if you look from this one red, you look to this yellow, you see that this one red has less infections and it also costs less. So this red one actually dominates this yellow one. Okay, so this is the basic presentation of the Pareto front, and I'm trying to explain to you that the decision-making process in countries like Slovenia and probably also in Italy, but I would not like to say anything about Italy. At least in Slovenia, it's not the way it should be. In reality, we should always look at some Pareto fronts in 2 or 3 or more dimensions and find the best decision. But this is far from how the decisions are made in parliament, etc. And what I'm trying to do is my personal mission is trying to incorporate as much as science as possible, as much as quality decision making into the Slovenian parliament. So far, it's been not so bad. And I was quite surprised that people do listen, of course, not 100%, but at least to some degree. So do not make decisions in general, do not make decisions based on one criteria of optimization. If possible, apply at least 2 criteria. So again, if you look at this Pareto front, you see that you're trying to approach 0, 0, which is left down. And the further away you go from left down, the worse it is. And if you look what humans did, so who are the humans? They are the medical experts, the best experts in a particular country. There are also some politicians, some decision makers, and they make decisions. This Pareto front was produced by AI programs, by genetic algorithms and similar. And if you look at these 200 countries were examined with this approach, and if you look at humans, they performed like this, about 20% worse. So actually humans performed much worse than when using these systems. And the question is, after the systems were designed, will everybody jump to it and use these tools and be happy about it and say, yeah, you did a great work, congratulations. We have sent our program free of charge to all European ministries of health, all European, in European Union, okay? And some said, thank you, thank you, thank you. But in reality, nobody used it. Even the Slovenian Ministry of Health didn't use it. They tried to use it. They didn't have the AI expert, and they just failed to do it. The system is a bit complicated, but not very, very complicated. It's a bit complicated. So anybody with good AI knowledge and computer knowledge should be able to use it. But the real problem is probably that humans don't like to use AI. They just don't want to listen to better advices than what they produce. They think, we humans think we are the best, we know the best, we have been elected politicians or whatsoever, and we are the smartest and we make the best decision. That's not true. It's far from true. It's because of that, it will get much more costly, and it in terms of business, in terms of money, and also in terms of infections, that is human lives. So I strongly advocate that we use AI, we use systems such as this. Again, this system is free of charge. Anybody can mail me, and we again try to make use of it. And of course, we are in contact with the new ministry and trying to come to terms. But according to one in experience, it's really difficult to use such systems due to several reasons. And this subjective reason that kind of human experts want to be the one that know the best, that they are the best. But computers compute better. I mean, it's such an easy to understand that our human brains cannot really compete whenever there is lots of optimization or computation in effect. Okay, let's look at this viewpoint. So this is mean country-specific stringency and depth. So on the x-axis, we have the country-specific, so subjective. I will not go into details, but this is, again, kind of stringency, kind of costs. And this is the number of deaths per capita, okay? Number of deaths per capita on the y-axis. This is on the left is social, in the middle is economic, and on the right is aggregated, so summarized or integrated. And if you look at the numbers here, you see that Hungary and Czech Republic, they have the highest number of deaths per capita, okay, in all cases. If you look at Italy, you see that Italy was above average, but they have spent lots of money. And Slovenia was also similar in terms of death, but it did spend less money. So you can compare the countries here, but again, you must understand what's the viewpoint here. There are lots of possible viewpoints, and countries perform differently under different visions. One of the reasons why Italy is here, because probably in this country there were lots of infections soon when we didn't know much about the infection, and we are trying to find the best countermeasures and similar. And USA is somewhere there. Okay, but if you look at this one, again, we have the social, economic, stringency, and then the joint. In those three cases, you see that now the most right, so the one that did most of the unnecessary cost. So this time we are looking at unnecessary costs. So it means that who overpaid, which country overpaid most? It was UK. In all three cases, it was UK, and also in another viewpoint here. And Italy did not come into those categories, so the top category. So it was UK, USA, France, and Spain. So, whereas Italy was better. So it means that in practical terms, you had lots of infections, but your quality of your decisions was reasonably good, not the best. Of course, if you look at left down, it's United Arab Emirates, but then they had much different climate and geographic conditions, so it's not possible to compare, let's say, United Arab Emirates to the UK. And if you look to Sweden and before, if you look at Sweden, they had another approach, again, standing out, and they really didn't pay much. They didn't pay much in terms whatsoever, because they were kind of soft, they used soft approaches. But they were not so good in terms of death per capita, so they're somewhere in the middle. And again, you see that there is not a single simple answer which is the best strategy coping with COVID. You decide, the country or society decide on its own, but after you decide about the strategy, then it is much better that you use a program. A program will help you compute the best countermeasures given strategy. So the top decisions should remain at the human level for human decision makers, but the operational decisions should be given to the computer and and then we would get 20% better results. 20% better results is much. Okay, now we change the subject and we go to the current situation in Slovenia. And from this analysis of Slovenia, I tried to softly show some indications which are probably valid also for Italy. Okay, so when I talk about Slovenia, maybe have in mind that partially I'm speaking also about Italy. Okay, in Slovenia in 2019, there were 6,800 doctors, I will call them doctors, medical doctors, 1,500 dental doctors, 8,000 nurses, etc. I mentioned 2019 because it was before Corona. But if you look 10 years backwards, so to 2009, from 2009 to 2019, the number of doctors grew by 37%, so about 1/3. About 1/3 more doctors were obtained in 10 years only, and similarly for dental physicians, etc. And so the logical consequence should be that the waiting time should go down, that the quality of the health service should improve, etc. But if you look at the data, the waiting times for operations increased significantly. Okay? And the number of people without family, it means personal doctor, increased from practically 0 to 130,000 in 2022. So these are two horrible numbers, horrible numbers, meaning that medical strategy in Slovenia is simply not adequate to fit the real problems we face. Okay. Now people also often ask me, what is this without a personal doctor? So it still means you can go to the hospital or something like that, but you don't have your own personal doctor with name, first and last name you can contact in case, for example, if you get some flu or something like that. They don't have it. And if I speak with colleagues in Italy, Germany, and other European countries, they are not aware of this phenomenon. This is really something very strange that happened in Slovenia due to various reasons, and we will study now those reasons. First conclusion is that one would say that, okay, and also computers improved, computers help, so that should be another plus. It turns out, if you look at the studies, that's not the case. It's quite opposite is often. So when you bring computers, doctors spend time with computers instead of with patients. And I've studied this in Slovenia, I studied this in United States, and it seems that that is the general tendency. And it's hard to understand because computers are so helpful. So how is it possible then you introduce something very successful? Everybody says that, oh, computers will bring a strategic shift in medical care, and turns out it is negative. And I think that it's pretty simple to understand that the computer is used in a totally wrong way. Totally wrong way. The strategic way of using computers in medical care is, in my opinion, the wrong one. And we had a recent discussion in National Council, and doctors, their representative doctors said that they spent about 2 hours per day dealing with computers, papers, reports, blah, blah, blah. So instead of improving quality of life, let's say, taking burden away from the physicians, we have overloaded physicians with computers, with reports, I don't know with what else. Yeah, so that's one of the reasons. We use computers in a totally wrong way in medical care. The other issue, which is also very important, and it's very, very problematic, is demographic. I've been studying demography for 15 years now as one of the best areas, best domains to use AI systems. And we have done lots of analysis. And we are also the only organizer of the demographic conference in Slovenia for the last 16 years. Each year we organize that conference. Now, the fertility rate, so the number of children per woman, should be 2.1 in order to have sustainable growth, that the number of people stays the same. Okay? That's kind of theoretical number, but roughly something like that. And what if that number is as it is in, let's say, in Italy, Slovenia, Japan, and it is from 1.2 to 1.6, depending on which country you look at. Even China has only 1.6 now. And in long term, of course, it means extinction. You cannot remain existing. And computing that for Slovenia, it will take 200 years, and there will be no genetic trace of any subgroup, autonomous subgroup living in Slovenia in year 2000, for example. In Italy, of course, is much greater and has two strong genetic groups, subgroups. One is in north and one is in south. And it, of course, it would take much longer time for an extinction. But if you look at Japan, there is a prediction that by the year 3000, the same event will appear there. Hopefully, it will not come to that. And it is for the scientists to study, to observe, to do empirical analysis and so forth, theoretical analysis. And then after we try to transmit these observations to the society and decision maker, hopefully proper actions will be taken in time. Why did it come to such low fertility? For example, even China stopped high fertility with the law that they can have only one child per woman for a while. Now they're trying to change it to be above 2.1, but they can't. So none of the countries that lowered fertility from below 2.1 have managed to have fertility over 2.1 again. So, but I think that China will succeed sooner or later, and we will see whether it will happen or not. If we're talking about extinction, this is kind of rather far in the future, but what is a consequence of the current life? It's the decrease of quality now, this year, last year, 3 years ago, and it will be for many years to come. Because when there are too many elderly as percentage, so it's the wrong demographic pyramid, and there is too little young people, it also means that there are too little doctors. Even with the same amount of doctors, you cannot handle the medical problems of the elderly population. This is one of the important burdens for the medical society, and we need to find solutions. And of course, in my opinion, my very strong personal and very strong scientific opinion, the solution is electronic and mobile health. With robots, with electronic devices, with teleconferences, etc., but used in a smart way, we can cope with all the problems. We can take care of the elderly population without overburdening young. We can decrease the waiting times for operations, and how can we do that? Well, I have proposed several operational solutions, and we see how our political decision makers will accept them or not, or implement them or not. For example, the issue of 130,000 patients without a personal doctor. There are no doctors available at this time. And also their quotas agreed with the unions are really hard to change, because the unions will go to strikes again. So the initial reason why suddenly there were people without personal doctor is that in agreement with the unions, they have set the upper limit of patients per doctor. But there is a simple solution. Just provide Uber style all licensed doctor. Of course, you have to test them, the doctors. The doctors can be, I don't know, for example, from whichever country. They can be from, let's say, Croatia or whatever. But if they apply to these regulations, they are tested. If they are okay, they can form a group. And this group can help those people without a personal doctor in the Uber style. If you remember Uber style, instead of fixed taxis, everybody which is licensed can drive a car and pick up passengers. Uber has lots of problems on its own, but in the case we don't have taxi drivers, that's an ideal solution. And the same can be applied here. And I said, in a couple of months, give you some money to pay the physicians and some software guys. I can solve this issue in a couple of months. So I've told that in a parliament, and we see what happens now. The challenge can be accepted or not. But for example, if it won't be solved in half a year or a year, then it's obviously that they have taken the wrong turn. But if they apply the solution, and hopefully then the solution will be implemented and resolved in a couple of months, and we will solve one of the problems which is really not acceptable for a civilized country to have such a thing. Okay, how are we with time? Antonella, it's okay with time?
Yes, of course. So you can go on. Yeah.
Okay, thank you. Okay, the second one, introduce one single medical warehouse and edge computing. What does it mean? Slovenia has only 2 million inhabitants, okay? So it means that you can have only one computer warehouse storage, however you call it. So all the data is there. And not only all the data, but also all medical routines. I was the coordinator of the electronic and mobile health in Slovenia 5 to 2 years ago, because there are mandates and they are changing. And then there we realized that there are about 35 different information systems in Slovenia, 35 different, mostly incompatible systems. And it can happen that different departments have different incompatible systems. So now they are approaching the stage that at least the data is stored in a way that it can be applied to by all institutions, but the same should be also done with the services. So for example, if you do some whatever procedure, it should be done in exactly the same way for all medical institutions and for all doctors and for all patients in Slovenia. And that procedure should be stored in one location in Slovenia. And of course, you don't need to compute on that computer. You can do it in the edge computing way. So actually perform computation at your own local computer, but the identity is guaranteed. Yeah, that is one simple solution. It's not very cheap, unfortunately. It does represent some reasonable cost, but it should still be much less, and the transition will cost. But afterwards, after you introduce it, it will be much less costly and much more efficient than what we have now. So the idea of, for example, using one warehouse for the whole Italy is probably not the smart one, but maybe some ideas and some, let's say, local areas could do the same. I'm not sure whether you have it already or not, but in Slovenia, we certainly don't. The second is how to use, so what is the smart use of computers? I mentioned that computers are used in a wrong way as a tool for reporting, as a tool for calculating, as a tool for, I don't know, typing in or something like that. No, doctors should not type in computers. When a patient should visit a doctor, then that patient should input their characteristics. So my identity, for example, I should also input what's the problem, so which are the characteristics of my problem. And after I put that information inside, the computer makes an initial assessment. The computer performs as an assistant, let's say as a young doctor, and compute say, oh, that guy probably has COVID, we should better test it or make self-test, blah, 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 okay? And the doctor then takes a look at the input of this patient and takes a look at the proposal of the AI assistant, maybe discusses a little bit with patient, and if everything is okay, just presses one button and or says okay. So that's all that it's needed. Okay, and all the reports, all the other, what is already written in computer is already stored and it can be processed. So you see, just one press of the button or just saying yes should be in most of the cases okay. Of course, there are some situations which are complex and the AI assistant fails, and then another longer procedure is needed. But that should be one of the rare cases. Usually the AI will probably guess. We have lots of the systems, lots of diagnostics, and we were also competing in another X Prize. So we are pretty sure that the AI can be a good assistant, not the decision maker, but the, let's say, the assistant that helps the doctor. So this is the way to use computer, that they ease the burden of the and leave the top decisions only to the doctors. Well, we have also some other systems, and one of them is so-called Slovenian Dr. Google. You know, if you have any medical problems, a long time, it's already a long time, that one of the best way is just to type your problems inside Google, search engine Google. And you get lots of replies, and then you look around and you find the best possible potential replies, and you go to some links, and this service is called Dr. Google. We have designed a system that performs in Slovenian and Italian language, and probably through the organizers, you can have access to the prototype. And this is just one of the systems. There are lots of the systems, lots of these teleconferences for communication with the doctors and similar. Yeah, so we've come to the end of this presentation. I'm not sure whether I was right in time, so 45 minutes, maybe even a little bit faster because we started 5 minutes later. But
Matthias, you are perfect. Thanks a lot.
Thank you.
And thank you, because you gave me a lot of suggestions about artificial intelligence. And it was very interesting for me because since the 80s, I'm studying social science and humanities, and I try to connect the penetration of artificial intelligence in human solutions. And you gave me a lot of suggestions about that. Then we have 3 different questions. One is from the audience, one is my special question, and one is the question on chat that Diego sent you. So I start with the question of Diego, which is, can I see the chat one more time, please? The question is, in Europe, which are the countries that have the most innovative situation regarding digital health system?
Digital health system. Well, it's hard to say exactly because I'm not familiar at this point. I can't remember exactly any studies of this kind. But in general, there are lots of the countries, let's say, also Italy is one of the good countries. There are some other countries like, I don't know, Netherlands, UK, but there are different styles, you know. Also, if you look at the how it's done, whether you have to pay or it's governmental healthcare, there are also different styles in different countries, and there are lots of different. So I would say that the situation differs from country to country, but it also differs from institution to institution. If you go to some institution, you can get really very good support in terms of telecom conference, digital help, etc. But maybe in the neighboring institution in the same country, you get quite the opposite. For example, let me give you my personal example. I was, when I had previously my personal doctor, and I was in India, I had some problems with food. I sent an email to him, and that was 20 years ago. And we did this session 20 years ago without problem. I can't do that now because my personal doctor retired, and the personal doctor I have now, she's not very fond of electronic mails. So she doesn't want to get electronic mail. You can phone her, but you can phone her only when working. You cannot, but you can send email whenever, you know. So in a way, these statistics are kind of, you know, misleading. It depends whether you have luck with your personal doctor, with personal institution. And if you look also in Italy, as far as I know, some cities and some countries have that done really at the top level, but I'm not sure whether that is the case for all parts of Italy.
Thank you. And from the chat, there are another question. Are there any relevant gaps, difficulties in the transformation process of the digital health systems? May you suggest some impactful measures in digital health transformation process that lead to the innovation approach, avoiding huge obstacles in the operative phases? It's a long and very articulate question.
Yes, but it is another very good question, because this is one of the top issues in introducing computers and AI in medical care. It has been long proposed that the AI will be first successfully used in medical care. Why? Because there are lots of the studies, lots of publications, lots of actual use of the systems that performed much better than the human doctors. I've shown you a case with the corona, but there are lots of the other cases when in the benchmark tests, AI systems outperformed humans. I'll just mention one case. When you get results from tests, for example, blood tests, etc., you can predict whether that person is healthy or whether that person will die in 1 year. And they have done this study with the AI approach and compare it to the solutions by human experts. And the difference was about 20% again. So AI was about 20% able to predict whether that person is in dire danger of dying rather soon. So this is actually valid in particular for elderly. But still, it is an important information because it means you must take some measures. And when they were trying to figure out, so then the expert said, okay, let's show me the results and we'll figure out how can you guess that much better than we do. And they were not able to do that. They were trying to do that. But what was the result of that? Finally, it turns out that there are some simple tests like staying on one hand, staying on one leg. So this is one simple test which shows you what quality of your body is in, or your overall system is in. And actually the knowledge strongly improved with the help of AI, but there was this misunderstanding or this different way of thinking in AI and humans. AI thinks in different ways, and these different ways are somehow different to reproduce by humans because we just have different hardware. So that is one of the reasons. And the second reason is, as I mentioned before, humans don't want to use AI decision makers. So when we made our program, we have given it to all the ministries in European Union. Practically nobody was interested in using it. They said, thank you, great, congratulations, nice move, okay, but tapping on your shoulder, you're a good guy, yeah, just keep on doing. But nobody was using it because it was complex, they were overloaded already, and they wanted to decide on their own. Okay? And that is a major human error, major human error. We can't compute well, we need help. Doctors need help in order to make better decisions and to make faster decisions. Okay, I mentioned in the case when the AI assistant produces the initial diagnosis and the doctor confirms it or not. This can be done, but is it done in any of the hospitals or any of the countries? No, I don't think so. I haven't heard about it yet. Maybe there are some experiments. As mentioned, we did compete in one X Prize competition where we wanted to design beam me up, Scotty. Scotty, do you remember this science fiction? So in science fiction, they have typically a device like a mobile phone, and you take some input from a human, and then this system tells you what's wrong with you and even heals you. Now the competition was about making decisions, and we did that program quite well, and we tested it, and it was pretty well. So it was performing pretty well. So currently the state of the art of artificial intelligence is pretty good. We can solve many of the problems better than humans, right? But the problem is with the introduction of that systems into real medical care. So there are, as I tried to explain, there are lots of subjective and objective issues. Subjective, they don't want, doctors don't want that somebody else makes decisions for them. And objective is that we do think differently. And I don't know, probably, hopefully, some country will decide, yes, we will go to that direction. Yes, we will improve our medical care system with the systematic use of AI. But if you look, for example, in Slovenia, we don't even have a single, we don't even have a single law or direction how to use emails in medical care. There are some basic instructions what you can do and what you cannot do. But as I told you before, my personal physician doesn't accept emails. So it's her right to accept them or not. And this is, I think this is one of the major reasons. So the national ministry should introduce electronic and mobile health in a smart way, and that should benefit not only the doctors, but also the patients and the country as well.
There is another question on chat. Are these challenges faced for healthcare professionals in Slovenia to adapt advanced, evolving digital health system to improve efficiency in totally?
Yeah, this question is again another good question. I think it is similar to the one I just tried to reply now. The situation I know the best is in Slovenia, and I mentioned you that there are big differences between individuals, institutions, etc., which I don't think is good because it leaves some people, I would say, in the dark. Yeah, some people are really, especially the younger physicians, are open to these solutions. They gladly embrace new ways, new mechanisms. But you know, a life of a physician in Slovenia is a hard one. So you have to study long. The income is not great at the beginning. And my daughter, by the way, is one of those young doctors, so I know her story well and similar stories. She's also a member of the young physicians. There is a society, and you have to have those staying over the night, etc. And I think that they place too much burden on human resources. Human resources should be replaced by electronic resources, and that's the only solution. We didn't talk yet about the overburdening of the physicians, but it's important. And the life expectancy of physicians, which was, I don't know, some 20 years ago, in many countries it was much better than on average because they have much better knowledge about diseases. But now it has gone down due to this overload, because the demands that we pose, just loading new burden due to demographic issues, due to whatever issue, without helping them with the tools, with the AI assistant and similar, that's not responsible to me. That ministries of health are not performing what they should, at the level what they should, because it's a typical some elderly minister, very good organizer, smart guy, who knows the profession very well, but he or she doesn't, at least in my opinion, I had experience with some of them, they do not understand what's going on in our society. Our society is facing crucial changes. It's the information society, introduction of new AI solutions, the demographic issues. This impacts all the society and maybe primarily the medical care. So when you understand what's going on, which are the real powers behind the events, you understand why the quality of the medical, even though the medical doctors and nurses are getting more and more overloaded, the number, the time waiting for operations is going up because these powers behind are forcing such demand. And medical staff should be eased. The work should be eased, less hours, quality hours, and all these electronics solutions should take work instead of them.
Thank you. I hope to have time for my question because there is another question for the audience. Please, can Professor say something more about the wrong use of computers? There are any multidisciplinary groups working on that on the Joseph Stefani Institute?
You know, some of these things I told you about, we actually did study, and some of the things we studied for decades, for example, demographic issues. And also we have been working on AI for, let's say, 3 or 4 decades, and AI in medicine as well. So some of the things are really studied for a long, long time, and we are getting pretty sure that in some fields, a major improvement is possible. Okay. Also in medical care, there is a major improvement, not only possible, but it's necessary. Unless the problems will only grow. Okay. But there are some areas, of course, we don't study in detail. We just, let's say, study it from the reports, maybe papers, maybe media, and so we are not experts in all the areas, in all the areas. But you know, if you go to a physician, if you talk to them, in a national council, they report. We have meetings, and they report to us, and they report, as I mentioned before, that they're getting overloaded with, let's say, typing some stuff into computers, into filling reports for some, let's say, what they did, how they did, blah, blah, blah. So they're putting lots of unnecessary information, okay? And as I mentioned before, the work of the physician should be eased, should be anti-bureaucratized. So unfortunately, computer is a perfect tool for introduction of additional bureaucracy. And that's why computers, the worst case is when a computer is introduced into a doctor for additional reports which are unnecessary. Bureaucracy is trying to do things better and better and better, but actually they're making life worse and worse and worse. So that's why from time to time you have to stop it. Let's say decrease that, decrease the use of computer for reporting, decrease the use of computer unless for the really, really important decision making. All the others should be left to the AI assistants.
Okay, so quickly, my special question for Matthias. So 2 days ago, in this place, we had an event dedicated to the telemedicine, and I asked exactly the same question, but now I would like to have your answer. As a social science and humanities scholars, I know that all the technologies are imposed, and not only when infrastructure and the software are available, but also when the society, in my opinion, is ready to welcome them. And the point of the society, for me, is strategic. And I would like to know if some studies have been carried out, of if you know if there are any statistics that highlights the special group of population divided by ages that are more interested in these new ways of digital health, and which are, if there are any groups that work on that.
Yeah, for Slovenia, of course, there are some groups. And especially if you look at the elderly population, there is a large percentage of people that they don't have email even. Some of them even don't have a mobile phone, etc. So they can't put data, they can't join teleconference, for example. But for them, of course, some relative can help. That's one thing. And the other is that you still need to have physical contact. You still need to have nurses and people without, let's say, means of telecommunication. They go to the nurses and they talk with nurses, through nurses, to the tele AI system, etc. The main thing is change here is that we stop thinking about computers as tools, as machines. You know, that they're not tools, machines. Think of them as assistants. Okay, in telemedicine. Okay. Also, if you have a robot, for example, there are some Japanese bear robots, so-called, which can carry people around. Carrying people around is a difficult task in many medical and institutions for elderly, because typically a man can be quite heavy and a woman is typically a nurse, and she has problems moving patients around. But these robots, of course, they're very expensive, but I'll just give you an example, okay? And yeah, it does behave as machine. It's not very intelligent, but still take a look what that machine is doing. That's doing a job of somebody which is like a human, you know? If you look at the car, and look at the horse, okay? If you replace a horse with a car, you get some pluses, but you also get some minuses, okay? And of course, a car is a tool. It's not an AI assistant because it's not smart. It doesn't learn. It's far from having cognitive abilities. And the AI assistants have several cognitive abilities. They can learn. They can talk to us. They can do lots of stuff. Okay? So there is another important difference. But replacing, for example, horses with cars, for doctors going from house to house, you immediately get improvement in productivity, right? And that's why changing the current use of computers, which is using them as tools, with AI assistants is the most important change we need to do. And for that, as you properly mentioned, we need this change in the society. This is essential. So we humans must accept them not as live beings. That's far from that. But we must accept them, for example, like, I don't know, horses, okay, or replacement of horses. So a kind of assistant. I'm not sure whether this is a reply to your question. Then you can.
Yes, it was the
rephrase it. You can rephrase
the
it.
answer. I'm looking for a social answer in a way.
Yeah, but in Slovenia there are professional institutions that help elderly use mobile phones, that help use them. I don't know, some systems, etc. So there are, in terms of society, I think that every country has that. Italy for sure, that systematically try to help, especially elderly people. Now, younger people, they know them at all.
They don't need them. Okay. Thank you very much. Thank you very much.
Thank you.
I think that we can finish our session. I really thanks Professor Matthias Gams for this very inspiring talk. And I hope to meet you in Trieste or maybe in Ljubljana, because we are very, very close. And we have two fantastic cities, very, very similar in a way. So we have our special connection. Thank you, Matthias.
Thank you very much. Okay. Bye-bye, everybody.
Bye.
Ciao a tutti.